Hello, today I'll be talking about administering cleansing enema. So first we will verify the order for it and then do our little routine of providing privacy for the patient, performing hand hygiene, donning on our gloves and whatnot, and explaining the procedure to the patient. We would first identify the patient with 2 identifiers to make sure we got the right patient for the cleansing enema. And reasons for this enema getting ordered would be things such as like they can't pass stool, and any pathologies related to constipation. First, we would assist the patient to a left side lying position with their right knee flexed up in the air. Then we would place a waterproof pad underneath the patient's hips and butt to kind of like make sure that there's no liquid being able to leak out in case there is any liquid leaking out. Then we would cover the patient with a sheet or blanket so that only their rectum is exposed, ensuring that the patient is like mostly like private, and we're not exposing any unnecessary areas. Then we would place a bedpan or a commode within reach that's easily accessible so the patient can access that pretty easily. And then we would start with the enema. So we would first, at the sink, add an appropriate amount of water to like a little enema bag. Then at the sink, we would raise the container, release the clamping, and allow the solution to flow long enough for the tube to refill with lubricating jelly. And then we would reclamp the tubing. Then after that, we would lubricate the bag, the end of the enema tubing. And then after that, we would gently separate their butt, obviously, and locate where like their anus is, so we would be ready to insert the enema. Then after that, we would instruct the patient to kind of relax, to kind of make the whole process easier so you're not kind of forcing it in too hard. And then we would hold the tubing securely at the rectum until the thing is finished administering to them. Then we would open the re-regulating clamp to allow the solution to enter with the container at the patient's hip level. And then we would raise the enema bag slowly to the appropriate level above the patient's butt so it flows properly. And then after that, we would lower the container if there's any complications, such as like the patient experiences any cramping or they're just not tolerating it well, because while lowering it, it would reduce the amount of output going into their butt at once, which would improve their symptoms. Then after that, we would clamp the tubing after all the solution is instilled inside of them. And then we would kind of place some like a toilet tissue or towels or anything kind of around their area to make sure that like when we're pulling the tubing out, it doesn't like too much liquid doesn't like seep out. And then we would also explain to the patient that having any feelings of like abdominal discomfort would be normal because you've obviously just introduced a bunch of liquid into their colon. Then after that, we would ask the patient to retain the solution inside of their stomach for as long as possible while still being in bed. Discard of everything properly, and then us tell the patient to try to have a bowel movement. And then after if they had a bowel movement, assess all the necessary stuff like the color of it, the amount, any odors, consistency, basically all the characteristics of the bowel movement. And then you would obviously document the cares appropriately. Thank you.